All right. So again, thanks so much. First question that I had for you is, how did you get started in the PT world? What was that like?
A great question. My name is Dr. Emma Shapiro, and I've been a physical therapist for about 10 years. I actually, got started for different reasons than what I'm doing it today. My uncle had severe cerebral palsy. He was wheelchair bound, and I always had a passion for helping people and just seeing him not be able to move and be so dependent on others. It really, as a young child, I was like, I wanted to do more. In addition, my parents were teachers, and they were especially teachers in special education. So I actually grew up as a teacher's aide for special education classrooms and led.
You were saying that they were leaders in special education classrooms?
Yeah. They're both one's a school psychologist and one's a special education teacher. And so from a young age, I was always a teacher's aide, essentially like helping in the classrooms. And then we once I became old enough and graduated college, then I actually started leading my own special education classes. And I almost went into special education teaching, but I really love sports. I played tennis, and so I wanted a little bit more of that like sports on the side, and so PT was sort of that great blend.
Mm-hmm. So tell me a little bit about the work that you do as a PT, because it's really broad.
Yes. Oh, it's so broad. It's so broad. So I've actually worked in a lot of different settings. I started working in the hospital and I did that for about 2 years. And then I transitioned into a skilled nursing home or a subacute rehab center. And I did that for 3 years. And now I work in outpatient orthopedics. I primarily work with adults ages, but I get a few 20 and 30-year olds, but I primarily work with those maybe between like 50 and 80. Um, it's so broad. We see a lot of people with neurologic deficits, like people maybe who have had amputations or strokes, spinal cord injuries. I also deal with general falls, deconditioning, weakness, global and chronic pain, Parkinson's. So I feel like I treat everyone and everything.
Yeah. Um, if you could talk a little bit about some of the methods or approaches that you use with your clients, that would be great. What are some of the methods and approaches that you're using, to when you work with your clients, patients?
Hey, Leslie, I'm so sorry. Did I cut out a little bit?
Yeah, you did cut out a little bit. I was asking, what sorts of methods or approaches do you use when working with your clients?
Yeah, great question. So I always ask them a lot of questions. I want to get to know about, how are they functioning? What are their needs? So I definitely approach it from, an educational and listening standpoint. And then I look at how they move, what assistive devices are they using, their home situation to sort of get this global picture. And then from there, create a little bit of like a treatment plan.
Mm-hmm. What impact does your work have on communities as a whole? Like what have you heard from patients that you've worked with?
Well, I'm really lucky. I work mostly now with the veteran population, and it's been really impactful. I mean, PT can impact so many people, but it helps with PTSD. It helps them feel more confident. It helps with them with their independence, and I think, I try to be a really good listener and make them feel very comfortable. And that's so important, I think, in everyone, but especially in the veteran population. And, they just feel really like welcomed and at home in the PT clinic. And so that's really nice to hear.
Mm-hmm. My last question in all of this is like, what can other PT people, people studying physical therapy school, what can they sort of learn from this conversation? How can they be sort of a part of that person's process, like in, achieving their quality of life? because I have to say I have a friend who finished PT school, and so she's well on her way to becoming a PT. So because she wants to do that. So yeah.
Nice. Well, I mean, PT is very rewarding. It's a hard career route. It's a lot of physicality, but I actually am working with a student right now, and we had a patient come in, and he was trying to get home, and he had some equipment needs, and so we at first addressed his equipment needs, and we got him a new transport chair, we got him a rollator, and then we were working with his strength, and just to see their appreciation was so meaningful for him. He said, "God, like this is why I got into PT school," and so I really think it's a great career route for someone who's really caring and really wanting to see change that's immediate. That's the beautiful thing is in 1 or 2 sessions, we can see a whole transformation of a patient. Like for example, another example, I treated someone the other day who had pretty severe Parkinson's, and I saw them come in with a cane, and I gave them a regular rollator, which is like a four-wheeled walker. But I really said to them, let me assess you for this special Parkinson's walker called the U Walker. I said, I think that'll really make a big difference. Because he was still walking really far out in front of him with the rollator. And I gave it to him, and it was like night and day. His confidence, how he was like, wow, I feel like I am comfortable walking and confident walking. And the whole family was just almost in tears as to how this changed his independence. And that's just so beautiful. So I think hold on to those special stories as a student and as a newer, older clinician, because that's what keeps you going. And then there's so many places that are great, amazing schools for PT. And so just do your research when you're looking into physical therapy schools, do your research into
You
did I
you were
sort of answer
talking
that
about
question?
doing research.
Yeah, doing internships. We really want to research the PT schools and make sure that you're in a school that you like the program. There's a lot of different programs out there that sort of specialize in different aspects. And so if you maybe want to do more neuro versus ortho, it's good to research that. I know I went to USC, and so they had a little bit more of a sports type of emphasis. And so it just depends on that. And you also want to research the surrounding clinical internships near you, like because usually the schools where the proximity to the school is, that's where you're going to often have the most connections to different internships. And so you want to be close by to those internships that you really are passionate about taking.
Mm-hmm.
Did I sort of answer that question? I
Yeah,
sort of answered it from two folds.
yeah. No, 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 you did fine.